Good afternoon and welcome to our International Nurses Day live conversation. Today, we'll be discussing the importance of the nursing profession to health services and the case for increased investment. I'm Shanique from the PAHO Communications team, and I will be your host. A huge thank you to our viewers for joining us via our PAHO Caribbean Facebook and PAHO YouTube pages. We are pleased to have you with us. To kick things off, here's a bit of background about International Nurses Day and the state of the nursing professional and the state of the nursing profession. There are approximately 9 million nurses in the region of the Americas, representing 56% of healthcare workers. That's over half of all healthcare workers. The second big fact is that 10 of the 33 countries in Latin America and the Caribbean have doctoral programs, and over 75% of these courses are in Brazil. This shows that there is an urgent need for all countries to scale up postgraduate education in nursing. The third major fact is that nursing is the least represented healthcare profession at the highest levels in governments and ministries of health in the region. So we definitely have a lot to discuss today. A gentle reminder that today is International Nurses Day and it is being observed under the theme No Nurses Equal No Care. Let's invest in nursing education, jobs, leadership, and practice. Now, if you'd have joined us last Friday, we had a high-level webinar hosted by the Assistant Director of PAHO. It was a very interesting event that showcased key technical leads who came from various countries across our region, and they were able to highlight best practices and the way forward for the nursing profession. This afternoon, we'll have a thought-provoking discussion on the importance of the nursing profession in healthcare services and, of course, why we need to invest in this very important profession. We're joined today by two amazing experts. We have Dr. Silviana Cassiana. She is our PAHO Regional Advisor for Nursing and Health Technicians. Dr. Cassiani, please say hello. We
Hi, hello everybody.
Awesome. We also have Mrs. Gina Dean, who is the Principal Nursing Officer, acting director at the Ministry of Health and Wellness in the Bahamas, and an executive member of the Regional Nursing Body of the Caribbean. Mrs. Dean, you have so many hats. Please say hello to our viewers.
Hi, good afternoon, everyone, and I'm happy to join the conversation today. And happy Nurses Month to all of our nurses out there, and Nurses Day.
Absolutely love that. Before we go any further, I want to do a big shout out again to all our viewers. Now is the time for you to type in the chat what country you're coming from. Ensure that you rep your country because we will be very excited to give you that shout out. Additionally, as our time continues for this conversation, we're encouraging you to make comments and also pose any questions that you'd love our experts to answer. We are ready, willing, and excited to have this conversation. So without much ado, let's get started. The first question goes to you, Dr. Cassiani. In general, nurses are a critical point of contact when we visit health centers, hospitals, or any healthcare service locations. And I really would love you to offer some insight on the importance of nurses globally.
Thank you very much for the question. And before to start, I wanted to join Gina and to say Happy Nurses Day to every nurse that is with us and the others that are working right now as well. Nurses are key players in health promotion, disease prevention, and they are the backbone of healthcare systems worldwide. Nurses working on the front lines of disease prevention, as I said, in the health promotion and health management, and also in the education and training new nurses. And in the pandemic, we saw the population calling every nurse as a hero in healthcare facility and emergency response. As you said, in the region of the Americas, we have 9 million nursing professionals. 87% of them are female. So, investing in nursing, we say that you are investing in women's work. And we are 56% of the total health workforce. So the majority of health professionals in the services are nurses. However, we have some challenges to discuss, and also we have opportunities. For example, we have the migration, issues of migration, and we do have a lot in the Caribbean. We have to discuss about the retention of nursing professionals. We saw that the mental and physical illness due to the workload in the pandemic. We need to discuss about working hours and also the environment where the nurses are performing their activities, and also the education. We have to collectively with the ministers of health, education, and finance to discuss about more investment in nursing workforce. This is the main issue for PAHO to discuss in the celebration of the International Nurses Day. We needed to invest in nursing to accelerate recovery after the pandemic, regain and sustain public health achievements, and get back on track toward universal health.
That's amazing. The context that you provided, it spoke to the importance of nurses, and the numbers that you shared. It allowed me to think of nurses beyond the public health nurses that we normally see in the health centers supporting immunization. But this is a huge workforce that contributes a large makes a large contribution to health as we know it in our region and the world. So that's very fascinating. I want to use this opportunity to push a question to you, Dr. Cassiani. Can you provide any examples about how countries in the region are investing in the nursing profession?
Talking about the Caribbean region, I would say that one excellent example, it is the Bahamas. And thank you, Gina Dean, to join us. And you can tell our audience about what the Bahamas is doing in terms of the development of the strategic direction for nursing and midwifery as an initiative of the Ministry of Health. But we do have Dominica, for example, nursing education programs have been proposed in the Dominica to meet the needs of the country in a joint coordination between the National Nursing Council, the Ministry of Health, Wellness, and another stakeholders. We have Jamaica. Jamaica is a leader in terms of the proposal of in the World Health Assembly to the global strategic direction for nursing and midwifery 2021-2025. And currently, Jamaica is developing the global strategic direction for nursing and midwifery as requested by the Ministry of Health. We have Guyana. Guyana has been discussed, their nursing education. And we do have Turks and Caicos. Right now, we have a mission of PAHO in Turks and Caicos to revise the curriculum for the Associate of Science in Nursing degree. And we do have other initiatives in Latin America, but I want to emphasize these activities proposed by the governments of several countries in the Caribbean.
That's fantastic. I am pleased to hear that countries across the Caribbean region are pushing forward to make the relevant investment and are committed to making those changes. Now, I have a question for you, Mrs. Dean, but before I do, I want to give a big shout out from Silvio. He has asked us to say congratulations to all nurses, and he is coming from the Brazilian Network of Nursing and Patient Safety. So thank you very much, Silvio, for saying congratulations to our nurses. Thank you, Dr. Cassiani. Mrs. Dean, the question I had for you was, Dr. Cassiani mentioned the additional investment that's been made by the Ministry of Health and Wellness and, of course, the government of the Bahamas in the nursing profession. And I'd love for you to give us some more details about that. Paint a picture so that our viewers can understand the commitment that the government is making in your country.
Well, we are actively engaged at the moment in the development of our strategic plan for nursing and midwifery. And we are using as our reference document the strategic directions that was developed by WHO. And so we hope to have that finished this year to really guide the process forward in terms of what we need to do for nursing to improve what it is we do to that ensuring that we provide the kind of care to our population that we need to as well. And so we will be engaging all of our stakeholders throughout the Bahamas. Our nursing stakeholders, our primary and secondary stakeholders to be involved in that whole process. But we do have, there is a need for a lot of investment in nursing, just as we have been saying that was one of the themes coming out of ICN, invest in your nurses, invest in nurses. And there are a number of targeted areas that we would like to see where we would like to see investments in the Bahamas. So a part of our strategic plan and strategic directions that we're going to be doing going forward will hopefully guide that process. But one of the big areas for us is postgraduate nursing education. That is an extremely important part for us. And we find that we have nursing deficits in a lot of our specialty areas. And so we need to train the nurses as specialists. And that when I say specialty areas, we're talking about things like intensive care, neonatal intensive care, emergency nursing, theater nursing, and even outside of the hospital, our community health nurses, our midwives. And so we need to make sure that we're investing in that group to ensure that they're adequately prepared to provide the kind of services that we would need in our population. Another area where investment is really needed as well is in leadership. Nursing leadership is really critical, and that is across the spectrum of healthcare services. We're looking at leadership that's needed in education, in service delivery, and all of those. Once we have the nurses who are trained in leadership, how are they going to? They'll be critical thinkers, and we're beginning at from the registered nurse or the trained clinical nurse. For in our case, all of them need to be trained as leaders so that they can provide the kind of supervision that we need. We will have the mentorship programs in place to address the nurses and novice nurses as they come out of school and that transition into nursing practice. And it just will also help to prepare our nurses to sit at the policy level. And that is one of the failings that we have sometimes. We don't have sufficient nurses sitting at the policy level in healthcare, and we nurses definitely need to be there. I can go on. I mean, there are a number of areas we are also looking at in terms of our health infrastructure and our actually health and healthcare system. When we talk about health infrastructure, we're talking about investing in our facilities, investing in the environments in which the nurses have to work, in the environment where our patients have to go for care. And we need to continuously improve on our environments. And we are having some challenges in some of our areas. And that is one of the areas that the Ministry of Health and Wellness is actively working on now. And not just the hospitals, but also our health care centers in our in the communities, as well as in our rural areas as well. We are actively working on trying to improve our healthcare facilities. But in addition to that, we also need to modernize, I would say, our healthcare delivery system. And the Ministry of Health and Wellness is engaged in that activity as well, saying how best to strengthen our healthcare delivery system so that everyone has access to the kind of care that they need. And there are some of the major areas. I'd also mention too that I think we need to look at in our compensation packages. I mean, there's so much competition for nurses right now. We have, just as in all, I think all of the Caribbean countries are impacted by nurses migrating to larger countries where they're better compensated, where they find better benefits and what have you. And so even though we have economies that are struggling, it's something that we need to look at how we can invest more in the compensation packages for nurses, to keep them at home and not have everyone running off to the US and Canada and what have you. But it's a difficult area, but I think there's an opportunity for us to look at different ways of funding so that we can address the challenges we have in that area. I'll stop now.
It's interesting that you spoke about the brain drain that you're experiencing in the Bahamas with relation to nurses, because I know in the Caribbean it is in Jamaica it is a very real issue. Mm-hmm. And while you spoke about the things that need to be done and the things that you're engaging the ministry on, I didn't hear it, and I was like, well, maybe they're not having the same challenge. And it is unfortunate that the nurses who are so important, they do need that. They don't have that representation in the right spaces, because it is only through representation that we will be able to address the challenges related to compensation and really stem the brain drain of our nurses. I noted that you are a nurse and you sound very passionate about issues related to nurses. And I also noted, Gina, that you have a seat on the regional body for nursing in CARICOM. And I wanted you to use this opportunity to speak about the state of nursing in the Caribbean, not just in the Bahamas, but what strategies you believe countries in the Caribbean could employ to prepare and retain nurses. We know that in the urban side, it's a little bit easier, but what about in rural and remote locations? What are your thoughts on that?
Yeah, most of the Caribbean countries do have similar challenges in terms of the migration of nurses. And in particular, it's interesting that you mentioned the rural areas, because that tend to be a greater challenge than in the urban centers. And we all have in all of our countries, we have areas that we find a little more difficult to staff and to make sure that we have adequate nursing coverage in those areas. Um, One of the things that we that we are actively working on, and I think would be good to assist us in that, is really regarding training, preparation of our nurses to work in those rural areas, because it nursing in the rural areas as compared to the urban centers is really very different. And I think we need to prepare our nurses better in that way. And that during that training, I think there's opportunity there to introduce rural nursing, because after some people who go out into the rural areas actually find that they like it, and we are able to keep them there. But I think they need to be prepared for it, mentally prepared. Sometimes I can use the Bahamas as an example. We have a lot of islands um, that we would consider rural, where sometimes the nurse may be the only healthcare provider there. And so she has to be a well-rounded person. Um, and so we look at training our nurses to meet that need. And so those nurses, once we have the training in place, it allows them to improve their competencies as well as their confidence, because a lot of times that is a challenge, that they don't have that confidence to be out there where they don't have immediate access to advanced level care. You have to look at transporting patients into our urban centers. And so training and preparation of the nurses to work out there, I think, is really critical. Also, I think we need to look at improving the technology in those areas, in the urban areas, such as the telemedicine, so that nurses working out there do have access to specialists who they can rely on when it comes to providing care away from the main centers. We I think it would be good also to ensure that we have, and I know this is difficult, but ensure that we have adequate staffing levels with the correct mix of staff in those areas. We try to have in our urban areas, I know in the rural areas, looking at having community health nurses who are able to have that broader health promotion, prevention, and looking at communities to try to improve their health before they even get sick. Then we need to make sure that we have our midwives, because we still have people out there who need obstetric care, who need midwifery care, maternity care, and that's important. And so that skill mix is very important when we have nurses out there in the rural areas. And I think that there's also, when we talk about opportunities, looking at opportunities to improve the benefit packages for nurses working out there. And sometimes it doesn't always have to be monetary. It could be in terms of providing additional leave, allowing them to move into to the urbanized areas for short periods, or just to take mental breaks. I think that's important. And so I think there are opportunities to look at the benefits package and see and listen to the nurses, hear what they are saying that they need, and try to meet those things as well.
I absolutely agree with you because one of the points you made that I loved is that in these remote and rural communities, the nurse is part of the heart of the community,
Right.
and they're so important. I see Dr. Cassiani shaking her head because she knows how important they are. I also wanted to just push over to Dr. Cassiani to kind of give us some more context about what the regional nursing bodies mean, because for some of our viewers, this may be a new term to them, and we want to ensure that we're demystifying those.
Yes, the strategy that the countries in the Caribbean found to discuss about nursing, it's excellent, and this is something that we need to export this idea to other countries. And I see my colleagues from Brazil, and I see colleagues from other countries in Latin America, and it's important to tell them about it. Something that I know from the regional nursing body, and Gina can add more since she has a seat in the body, and also is an active leader in the Bahamas, and also in the whole Caribbean. But the regional nursing body is a strategy that puts together in a table representatives from the Ministry of Health, nursing representatives. Most of them are the chief nursing officer. Also, representatives from the universities and representatives from the Nursing and Midwifery Association. So, from each country, oh, of the Caribbean. So, these representatives, maybe 20, 25, they sit together in a basis that it's planned ahead to discuss topics concerned to education, practices, service, regulation around all the countries in the region. So that's a very excellent strategy because they can discuss their lessons, their experience, to learn from other successful experiences, and to share concerns that they have among the nursing profession. I'm sure that Gina is going to add anything else. And also, they have policies, they have documents under the CARICOM, that is the Caribbean, the main body to the countries of the Caribbean, the government. So, this is an important strategy. So, together they are stronger, together they are more united to find solutions, to find any initiatives that can be employed from one country to the another. Gina, feel free to add more.
Well, I think you covered it very well. But yeah, but basically that's what the regional nursing body does in terms of it. It allows us the opportunity to discuss issues which are often of mutual concern. So you would go and you would talk about what is happening in your country, and only to find that it's almost happening universally in the other countries as well. And so it gives you the opportunity to hear what other people are doing, what other countries are doing, how they are dealing with some of the issues. Is it something that you can take back to your country to improve your system based on what you have learned and from the sharing that goes on there? And they also look generally at um, nursing standards, helping, because the regional nursing body does have a strategic plan as well, and that includes the nursing standards that we want to ensure that we maintain. And so it's a very good, it provides a very good opportunity for sharing, learning, lessons learned, what have you.
Yeah, for example, Shanique, in case of Brazil, no, I see my colleagues from Brazil. It's a big country, many, many states. Maybe at the national level, They could arrange some structure like the regional nursing body, no, the Brazilian level, where nurses that works in the secretary of the state health, no, they could join also at the university level, and members of the National Association or Council of Nurses, they could sit together to discuss at the national level. And maybe other small countries or even the Indian region, they could sit together. So this is the word, to be together, to fight together, to find the solutions together. This is the word together. And this is what the regional nursing body in the Caribbean are doing.
Fantastic. I have to say that that's a really good best practice that we should look at replicating in other countries. And I realized that we did give a bit of time to talking about the regional nursing body. And it's so important that in these type of conversations, we provide actionable strategies in order to improve the state of nursing. It's one thing to complain about what's not great, but it's another to say this is what good looks like and be able to put that in place in order for people listening on this conversation and interested in improving the state of nursing in their country. They want to know, what can I do? Because we're all aware of the problem, but we need solutions. Viewers, we are at the halfway mark in our conversation. For the last half an hour, we've been having a fantastic time with Dr. Cassiani, the regional advisor for nurses and healthcare and health technicians. And we are also with Gina Dean, the principal nurse and also the acting director of nursing at the Ministry of Health and Wellness in the Bahamas. Now, for those who are just joining us, we are in the midst of our International Nurses Day conversation. And I want to use this opportunity to give a shout out to Tanya McFall Major from the Bahamas, like Mrs. Dean, and she's saying, Happy International Nurses Day. We also received a shout out from Santiago in Brazil saying good afternoon. And we also have a question from Silvio in Brazil asking, what strategies can we use to develop nursing leaders in a scenario of little financial investment? That question is to you, Dr. Cassiani.
Let's talk about the leadership. No, that's an important issue in nursing, and I want to ask the audience, what is important? Why it is important to think about leadership in nursing? Why we have been discussing so much about the leadership? As I said previously, we have 87% of our nursing workforce female. So we have issues about gender in the profession. Also, we have another important aspect that is in terms of the health team. We Talking about leadership, we are talking, as Gina said previously, about the skill mix. So when we are discussing about the team, we are discussing about every professional in this facility or in the service working together, learning together, with the patient at the center of the care. But in the question, leadership, it's something that can be trained at the undergraduate courses. No? It can be seen as the nurses in the health facilities, the health services, as a role model player. No? How one student, for example, sees the nurse when she is or he is in the position of leader. And also, after the undergraduate course, so education and continuing education to prepare itself as a leader. When I was a student in a nursing school many years ago, no, I always have a closer look for the nurses who were working at the health services, no, and I could see them, some of them, not all of them, as a real leaders of the team. We could feel that when this nurse was in the shift, when the nurse was working, she was the leader there. No, and I could learn it as a student, looking at the way that this nurse was performing their activities. No, so one suggestion that I give to my colleagues and also to my to the audience here, no, observe the nurses that you see that it is a leader. You have one here in this Facebook that is Gina Dean. You can see the way that Gina talks, the way that she is telling about her country and her activity. So learn from her, learn the way that she is in the Ministry of Health. We do not have in several countries nurses in the Ministry of Health, and we need them there. No? So this is an important topic to say to my colleagues, to the audience. And another way it is to develop yourself as leader. No, take some courses, read books. No, and practice yourself in the team. But Gina said some important word that is a skill mix. This is good. No, we do not want to be leaders. We want to work as a team. We want to have every professional in the team recognizing the work of each one that we are performing. Back to you, Gina, if you want to add something.
To deliberately look at your mentorship programs, and that is a wonderful way to develop leadership, and to be, and for leaders to be intentional about it, to actually work on developing others coming up so that they too can be leaders. Even so, and that is one of the main areas, especially if we in a scenario like the question asked of where finances is going to be a problem for actually going out and doing formalized training. Mentorship is really, really key, and a good method.
I think the idea of mentorship and also looking at a leader that you admire and aspiring to be like them is very useful. It's something that doesn't cost any money to go to somebody who you admire to say, I would love for you to be my mentor. And what time do you have? Can teach me a few things, maybe a conversation once a month. It it takes a bit of confidence, but it is very useful. And we have to be realistic. We are operating in a health system that it has challenges, and we have to look out for ourselves. Our nurses need to look out for themselves, even as wide scale changes are being proposed and also being made by the different ministries of health. So I love that autonomous statement that you guys would have made about you taking charge. What do you want to learn? What sort of training do you think you need? Whether as a remote nurse, a nurse in a rural area, or a nurse looking to move up in your career. So, what sort of things you need to put in place? On that inspirational note, I would love to hear from you, Dr. Cassiani. Well, let me start with Mrs. Dean. What do you envision for the future of nurses in the Bahamas?
So for nursing in the Bahamas, what I would like to see is that we have nurses are highly respected professionals, that they are well respected as competent, well trained caregivers. They are excellent decision makers, and they are leaders in our communities, in our hospitals, and as stated earlier, at the policy level. I would also like to see nurses who are well compensated, as far as the country's finances allows, um, that we have integrated technology into nursing in the future. What we used to think of nursing informatics as just this little specialty area of nursing, but really all nurses now have to be involved in nursing informatics. And so that's, I envision everyone being, when we talk about that, we're talking about the use of technology, use of the electronic medical records and data collection. So I would love to see that our nurses are researchers, that they are engaged in doing research so that we can have evidence-based practices. And I would also like to see that the majority of nurses actually, and in the future, actually working in primary care, because that is where the focus, I think, needs to be. And my background is community health nursing, and so I probably have a bias in that area. But if we can have nurses who are doing health promotion, illness prevention, before people get to the point where they have to be hospitalized. And so that is where I would like to see nursing in the future. Well-trained, well-educated nurses, respected and with opportunities for growth, and that they can feel fulfilled in their career.
We have a tall task ahead of us in the region, but I love it. I love it. Dr. Cassiani, I want you to answer the same question, but from a Latin America and Caribbean perspective, and also globally, because you would have that sort of, you would be in that sphere and able to give us that insight.
I heard something in the past week that it is in my mind, and I want you to have this in the mind of everybody who are listening us. In the future, we expect right number of nurses, right care, right time, right places to work, nurses, right training, right competencies, right recognition. This is what we expect for the future.
That is such an apt statement. It is to the point, and it is exactly what I'm hearing from Gina, from you, Sylvia, and what we can see in the literature about the future of nursing. We are coming up onto the end of our conversation, just about 15 minutes left. And at this time, I really want to do a few shout outs. We got one from Costa Rica earlier, from May. Thank you very much. We also got thank yous from the people who post questions, example, Silvio in Brazil. I have a question, a final question to pose to both of you. And that question is, if you had the power to modify the regulation of nurses in your country, that's for you, Gina, what would you modify? No, as in today. You could do it. You are a leader for a day. You can modify it now, and the impact would be for a longer term. What would you do?
I would ensure that the nurses who are they are advanced practice nurses are able to practice to the full extent of their training. And that is a challenge that we have right now. We're in the process of updating our Nurses and Midwives Act. Our Nurses and Midwives Act is ancient. It's over 50 years old. And so it doesn't provide, it doesn't allow the nurses, modern nursing, the scope of practice that to which we are trained now. And so if I could, with a swipe of a pen, do that, that would be one of the things, making sure that they're able to practice to the full extent of their training. legislatively. Yeah.
I thought your answer would be about compensation. I'm a bit
Well, no,
disappointed.
we you talked about we was talking about regulations.
Regulation, yeah, that's true.
So
I
if we're
thought
talking regulations, that was where we were
yeah,
going.
I thought you would just slip that bit in about compensation.
I actually would include that as well.
Dr. Kassiani, what would you modify if you
You
had the
know, in Paho, we have discussed many years about the role of nurses in the first level of care in the primary health care. So if I have the power to change something, I will ask the educational level to prepare more nurses in as advanced practice nurses, maybe nurse practitioner or specialists like Gina said that she needs so much, and prepare those nurses to work in the first level of care. Secondly, I will increase the jobs of nurses, and in the regulation sector, I will approve a law to give more expanded roles to nurses in the first level of care. We are talking about trained nurses prepared at the university or college level to perform activities as advanced practice nurse in the first level of care at the primary health care services.
As we talk about education, I really wanted to slip in a little question about the statistic you shared earlier regarding the courses, the doctoral and higher education courses available to nurses in the region and I mean Latin America and the Caribbean, and the fact that 75% of those courses are in Brazil. Now, I'm keen to hear what both of you think about how we can increase the number of postgraduate courses in the region. And this is we have a short span of time. So first I'll start with you, Dr. Cassiani, and then with you, Mrs. Dean, about the perspective for the Bahamas.
We are talking about doctoral level, but even the master level, it will be okay. The issue is that we need to prepare faculty for the next generation of nurses. Faculty that can be used the evidence-based practice, can conduct investigation, can read scientific articles and discuss with the students. To do so, to prepare more, we need more advanced courses in a master and doctoral level. So we need to increase the number of nurses which has the doctoral and master level. However, in the Caribbean region, we just have the University of West Indies in Jamaica preparing nurses. And in the Latin America, we have a few courses, but most of them in the Brazil. In Brazil, Brazil has 73% of all courses in the Latin American Caribbean region to prepare nurses at doctoral level. So to increase more this number of nurses, we need more courses free of charge in the countries of Latin America and in the Caribbean as well. The only way to prepare more nurses will be having more courses and free to the nurses.
That is a big need. And also, what I'm hearing is some actionable steps about what we need to be looking at if we want to make the change that we mentioned earlier for the future nurses. Just a quick jump over to you, Mrs. Dean. What are your views regarding the future in terms of
Well,
nursing education in the Bahamas?
so one of the things that we are happy about is that the University of the Bahamas is in the process of developing master level nursing courses. We do
Wow.
have, yeah, we they're in the process now, and so I mean, of course, it takes a while going through all of their
Yeah.
whatever necessary, all through the academic boards and what have you. But we do have nurse educators who are trained at the doctoral level, and so we are developing master level courses that can be offered locally to the nurses here, and so that is an excellent development for us as well.
That's
Um, yeah, and so
it's
we're also looking
exactly.
at partnership with other universities as well. You know, we do have many of our nurses who would attend UWI, as Dr. Hassani you would have mentioned, but we also looking at trying to see what is available here, because many times people are not able to uproot themselves to go to the other universities, and even though a lot of the universities now are offering online courses, very often they have components that where they have to attend in person, with face to face, and so developing those available courses to be available locally is really critical.
I have to say a big kudos to the University of the Bahamas, because they're making a step in the right direction, and you're absolutely correct. I saw Dr. Cassiani shaking her head, because I imagine the practical components, those, if you're in another country, you would need to uproot yourself at least for a few weeks in order to complete those courses. And that is financially onerous. It also means you may need to take time off work, time away from family, and you need to find yourself in a new space. So that's a big deal.
Yeah.
Viewers, we have been having an amazing, interesting, fantastic conversation with Dr. Cassiani and Mrs. Dean from the Ministry of Health in Bahamas, and Dr. Cassiani from PAHO WHO, respectively. They have been sharing their views with us about the state of the nursing profession in the Caribbean and Latin America, but with a lot of emphasis on what's happening in the Caribbean. And they've really spoken to us also about the type of investment we need to be making if we want to change our reality and have a new way of doing things for nurses. With over 50% of all healthcare workers being nurses, it is very important that we consider how we engage this group to ensure that we stem the brain drain that we are seeing across the Caribbean with regards to the nurses, the specialized nurses, nurses willing to work in remote areas and rural areas. At this point in time, I want to give our panelists an opportunity to make a 1 minute to reiterate any key points in a minute for our viewers. I'll start with you, Mrs. Dean.
Thank you very much. I would just really like to emphasize that we do need to keep this in the forefront of what is happening in our countries, and recognizing that nurses, investment in nurses will be investment in your communities generally, because as the thing said, nurses, no care. And we need to make sure that we invest in preparing our nurses to face all of the challenges that they will continue to face, even outside of the pandemic, or everything, all of the issues that we're having with our non-communicable diseases as well. They are also major challenges that we have to deal with, and so nursing will be key to make sure that we are able to cope with that. And as many of our countries look to move into universal health care and different models of universal health care, nurses will be critical in that.
That is absolutely true. I saw a note recently that said if we are serious about universal health coverage, we have to be serious about nurses. On that point, I want to push over to Dr. Cassiani for her to share her 1 minute, the key thing she wanted to share with our viewers in a minute.
I want to continue what Gina said. Investment in nursing is not a cost. It's a way to accelerate recovery after the pandemic. It's a way to regain and sustain public health achievements and get back on track toward universal health. Thank you.
Fantastic. That was very succinct and it was very true. If it's if we're investing in our nurses, it can't be a cost if we're serious about universal health coverage, transforming our healthcare services. It is something that we are spending now to reap the rewards in years to come. And in some places, it may not even take years when I consider what Gina says about the rural nurses and the type of support they need, and also remote nurses who are just really important members of the communities that they serve. Viewers, it's been amazing having these 55 minutes with you. I can't believe an hour is already done. I feel like I just started speaking with Gina and Sylvia about nursing,
Yes,
but
it
the
went by
time,
very quickly.
yeah, it went by too quickly. Our viewers are also saying that it's been an excellent discussion. We got a shout out from Agua saying many congratulations on this well-deserved day of nursing around the world, remembering those who are no longer with us. And we really have to take this opportunity to say thanks to our nurses, because at the start of the discussion, Sylvia mentioned the huge contribution they've made to the pandemic response. And without them, I'm certain a lot of us would not be able to get to our immunization shots, routine our COVID 19, who would be caring for us in the hospital when we've gotten the advice from the doctors, who would smile at us because my earliest remembrances of nurses is when they come and say, okay, Shaniki can sit down, relax. It won't be too bad when you get the shot. And they would do the school visits. I'm sure you two have similar memories.
And happy
Yes.
International Day.
Yeah,
Feliz Dia de las Enfermeras e Enfermeiros e feliz Dia da Enfermagem. Happy International Day to all nurses in this region.
fantastic. Gina, I'm giving you the opportunity to say the same.
Thank you very much. And happy International Nurses Day to all our nurses or everyone who's listening. And if you can pass that message on to any nurse that you see today, just tell them happy International Nurses Day.
The experts in our conversation have said it best. Nurses are critical for the future of healthcare, and it is important that we have a day to celebrate the contribution that they've made. I have to say a huge thank you again for joining us for this conversation. I'm Shanique from the PAHO Communications team, and it's been my absolute pleasure to be with you. Thank you very much for joining us, and until next time.